We looked at starting with desensitization more than sensory rehab. You want to start with stuff that people can tolerate, because remember, their nerves are hypersensitive. They get allodynia very easy, complain of pain for something that they shouldn't. So cotton balls are a good way to start. Now we have them in nice little buckets here, and these are good for if you are in home health and you need to be traveling. But a lot of times you're going to have the people perform these on their own at home, so you want to make sure they understand it's a good home program, because they'll have to do this 5 to 10 minutes several times a day. But if you do in the clinic, especially when you incorporate sensory rehab, these are also the suggestions that you will have. So as you saw Susan performing that nice demonstration with the cotton balls, you would do the same thing as you would move into like your rice then possibly. You can use corks of different sizes. Popcorn's good because it has the little nubby edges on the end, and that can cause some aggravation all the way up to sandpaper. In this section, we're going to look at fitness. So let's look at exercise. Okay, so exercise as a general, as a whole, and specifically now cardiovascular fitness. The best cardiovascular exercises are something that your patient or your client enjoys. So therefore, if they enjoy it, they may stick to it, and they then will get their maximum benefits. Your patients may even be surprised at how quickly this form of physical activity can become a habit and become part of their life, so that they can have a reproducible and sustainable activity that you initiated for them. Exercise not only helps to fight heart disease, but for sedentary people, which sometimes that's what we're dealing with. Remember, behavior is sometimes the hardest thing to change. You may know that somebody who has arthritis is going to benefit greatly from exercise, but maybe they've never exercised in their life. So it can be a challenge. All we can do is teach them the benefits of it and give them the information, and hopefully they'll choose the direction you feel is best for them. But anyways, let's get back to, for sedentary people, just adding any bit of exercises, whether it's a little bit or anything, to the daily routine will reduce the risks of high blood pressure, osteoporosis, breast or colon cancer, depression, anxiety, and stress. So if you present things in that aspect, you may see a little interest in trying to incorporate activities into their daily life. The greatest benefit from physical activity is seen in people who formerly had no activity, and then they start to do activities such as walking or cycling or swimming, tai chi or yoga. And that's where you tend to see the greatest benefit. For the people who are already into the exercising, they want to keep their benefits, or they may need to increase their cardiovascular output, or to increase their target heart rate and so forth. So we can help them with that as well.